Hello, I'm Sreya Ahuja, and here's my take on the ecosystem of self administration of medication in hospitals. So let's dive directly in. This is what my concept is basically a bedside retractable setup with a slot box dispenser and a removable tablet. How this works is that a nurse stocks up the box every day for that day's medication and sets timers on when the patient needs to have them. So slots open only when it is time for the patient to take the medication and contain only that amount of medication that they need for that specific dose. The tablet alongside displays information related to the medication, what to expect, what it does, when to seek further help, etc. And along with that has a way to snooze the slot box for a while and maybe ask for assistance from a doctor or a nurse if required. The advantages of the system are that the tablets can keep being reused with through different wards and rooms. The development of an app with all these features is fairly cost effective, and the slots in the box are modular so they can be personalized for different patients based on their medical schedule. The medicine is rationed so they cannot be misused, and a nurse needs to refill them every day so the updated treatment plans can be in effect. But how did all of this evolve? So let's rewind a little bit. So, first, it all began with what we heard. Medication plans evolve over time, the modes of administration vary, and the level of expertise required may also vary. Simple example, pills versus needles. What this could also mean is that these plans need to be updated regularly and that there might be some level of assistance that might be required from time to time. There were also some concerns around mental health, hypochondria, Munchausen syndrome, and the want for euthanasia. One thing that we didn't know for sure was the expectations from stakeholders regarding the entire idea of self administration, and this ran parallelly with the assumption that stakeholders were on board with the idea, and more importantly, that the human factor cannot be completely removed from most scenarios in healthcare. So, what was looked at next was defining some themes that came out of the micro challenges listed and then carry out interviews to validate our assumptions and to gain insights. Numerous interviews helped narrow down focus on what the patient's most prioritized requirements are. So, there was an extensive brainstorming session that led to prioritizing timings, dispensing, accessibility, language, mental health, and money as the key factors that had to be taken care of while thinking of a solution. So, how might we create a solution that enables patients to successfully self administer medication that makes them independent, is safe, easy, accessible, economical, and scalable? This led to the first concept where a mechanized system would replace a nurse. It seemed like a very simple idea where exact dosages could be accessed by patients, but it was extremely intensive. The next idea turned out to be a smart cupboard that would give access only to recognized stakeholders with a fingerprint sensor and would display information on the screen and talk to the patient as well. It was basically like a medication assistant. But this hardly solved the problem for independence, accessibility, or cost. That's when the final idea came about. Now, there are limitations to this idea as well. For example, intravenous medication will require assistance and expertise. And there are near future outlooks where the slot box and tablet combination can be gamified for pediatric wards to keep kids engaged and reduce their sense of fear. So that's basically how I envision a scenario for self administration in the current time. Thank you.